will try to take you through a small journey of a patient, of a person who wish to see me, and how do we go about an OPD consult, how to get in touch with us, what is a pre-operative evaluation, how does one go to the theatre, does actually stay in the ICU, what about the drains, and so forth. So classically, let's say you wish to speak to me and you wish to talk to me, or you wish to take an appointment, you could probably see the name of my coordinator, Nalini. She is the one who should be contacted, or you can also visit my website at www.atulpeters.com, and you can book an appointment, or you could contact Nalini at the number given below. And once you have an appointment with us, you must get all your documents, you must get all your investigations, any previous surgery, any documents, any medical documents that you have, please get them, so that we can understand what you've undergone and how we can help you the best. So you may be a surgical candidate, you may not be a surgical candidate, however we need to see all your previous medical documents. So appointment is booked. It's good to be about 5-7 minutes early than the appointments. I see you in my chamber here at Shalimar Bagh. I may also see you at Nehru Place if that is more convenient to you in South Delhi. And having seen you, we would want to do a body composition analysis. That will tell us roughly what your body is composed of. The percentage fat that you have, your height, your weight, your BMI, your segmental analysis, and so forth, including your neck circumference. We will also go through your medical records and see if everything has been okay with you. If you're a diabetic, what drugs are you on? If you're an insulin, what type of insulin are you taking? How are your blood sugars keeping? If you're a hypertensive, what are the drugs that you're on? And so forth. So we need to check all your medical history. Having checked that and having explained you everything in terms of the correct surgical options for you. So it's not that all patients will get one surgical option. So we have almost everything under our sleeves, from a laparoscopic sleeve gastrectomy to a banded sleeve to bypass to a root gastric bypass to a banded bypass to an MGB to a duodenal switch and so forth. Depending on the requirements, your body composition, your age, the related comorbidities, your BMI, we shall choose a procedure in accordance with you. We will see what is best for you. So it is not for the surgeon but for the patient that the surgery is done. We will choose the best option for you, and then after we have the consent from you that okay, you understand all the procedures, you understand the risk, you understand the complications, you understand the lifelong commitment that you need to do, that we will do the surgery. Now that once we have decided that the surgery needs to be done and what is the type of procedure, you need to undergo a battery of tests. We need to do your blood investigations, your urine investigations. We need to do your X-ray chest, the ECG, your cardiac evaluation. We might just do a 2D echo to see your condition of the heart. We might have to do a stress echo that the cardiologist is the best person to decide. So we take a cardiology consult and they decide what all tests they need for your cardiology clearance. The anesthetist does a pre-anesthesia checkup. He sees what all investigations he would need, and when he thinks it is deemed okay to undergo a surgical procedure. Post that, a psychological evaluation is done, an endocrinology evaluation, and a physical examination by a physician and an internist is done to see and complete the whole array of investigation and see that your surgery is safe. The most important part of the surgery is the safety of the surgery. So all these things are evaluated, and once everything is done, we know that the surgery can be done safely without taking undue risk. Post this, after getting your pulmonology, your cardiac, anesthesia clearance, you can be posted for surgery. Now, many patients and few of my patients do ask me that would they be put on any pre-operative diets? And I always tell them, 7, 8 years, 10 years back when we started our bariatric surgery, yes, we used to put you on diet because it used to help make us technically, it used to be technically easy for us to handle your liver, because the liver would shrink in size, the glycogen stores will go down, and technically it became easy for us. But in today's era, when the patients are actually traveling from different states to me, from different countries, it would be very difficult to maintain the diet. So largely you are not into any diet reform. I really do not give them any options where they have to take diets and restricted diet for 2 or 3 weeks. We can, once surgery is fixed, we can do without this dietary part. The other thing is upper GI endoscopy. So at my institute, upper GI endoscopy is not mandatory, and we do not do upper GI endoscopy for all the patients. Yet, all patients who have had symptom of reflux or symptoms of acid peptides will undergo upper GI endoscopy, because I understand a few of my patients are very fearful of the fact that upper GI endoscope and a tube is to be put down there. So not all patients, but select few will definitely undergo. Especially patients who have a reflux will undergo an upper GI endoscopy. And patients who have had reflux or documented reflux or esophagitis or Barrett's esophagus, we may even change the procedure. So if we've decided to do a sleeve and we see a reflux, we may alter your procedure to do it into a bypass. Though recent studies have said that a sleeve can very successfully be done in patients with reflux by doing a Heitel repair, which is a small technical modification that we do. But personal choice, I would be very happy to do a bypass in a patient who has reflux than just a sleeve procedure. So once it is decided, all financial clearance are done, all anesthesia clearance are done, you would be given a date. And if the anesthetist feels that you could come on the same day of surgery, we would call you on the day of surgery. Otherwise, we could admit you a day prior, especially for old patients or patients who've got uncontrolled diabetes or uncontrolled OSA. They might have to be given a CPAP or a BiPAP overnight or even for 1 or 2 days to prepare them for surgery. But largely, most of my patients would come on the same day of surgery. And you're fasting that overnight fasting, you come, get admitted, everything's ready for you, all the rooms, everything is ready, you change, come to the OT clothes, then you shift you to the operation theatre. The surgery time would be anything between 30 minutes to 1 hour 30 minutes. Yes, you heard me right. It's 30 minutes to 1 hour 30 minutes. So a sleeve would be anything between 20 minutes to 30 minutes to even 40 minutes at times. And a bypass could be anything between 45 minutes to an hour or 30 minutes. And this is done laparoscopically, so we make tiny holes. We don't use any stitches, we use glue. So when you come out of the theatre, there are no stitches, there are no bandages, there are no tubes, there are no drains, there are no pipes. So your tummy would be absolutely the way you had it before the surgery. So no stitches, no bandages, no drains, no pipes, no urinary catheters. We don't use any of those. And you are shifted to the recovery room after the procedure. You would be allowed to talk to me on the OT table itself. The anesthesia that we use is usually desflurane, which is the recommended for bariatric patient. The anesthetist we have are brilliant, and they have been trained into bariatric surgery and bariatric anesthesia, and they are just par excellence. So they will take care of your anesthesia. You will not be given any mask, because I understand a few of you would be having the fear of getting a mask over your nose and lying down and seeing that OT light. So you will not be undergoing any of the things. We start with the anesthesia in terms of your IV anesthesia. Surgery happens, you finished, you go to the post-operative area where you stay for about half an hour, 40 minutes, and then you're shifted to the ICU, the surgical ICU. It is a mandate that all the patients go to the ICU, primarily for pain relief, and you stay in the ICU for just 1 day, and post that, the next day you're shifted back to the room. And once you're shifted back into the room, you will be taking clear liquids, and in fact, clear liquids and sips only will be allowed as early as 3 to 4 hours after surgery. Yes. 3 to 4 hours post-surgery, you are allowed to take clear liquids or only sips. You will have to go to the washroom yourself to pass urine. We always encourage all the patients for early mobility, which is going to be very helpful in your early recovery. The next day you go to the room, and from the room, I would say 70 to 80% of my patients are discharged the next day. So within 24 hours you've been discharged, without drains, without pipes, no stitches, and you can actually drive back home. The pain is much under control. Primarily because of the incisions that we use are very small, and the procedure is very small. It's a short procedure, small procedure, and we also use a special technique, something called the TAP block, which is transverse abdominis plane block, which also give a brilliant pain control to you. So the next day you're gone home, and the first visit is usually within the first 5 days, where I see you check your tummy and everything. And the next visit is on the 15th day or the 14th day, where the phase of your diet would change, especially with the nutritionist. And that's how it goes on. So first month, probably 2 or 3 visits. If you're from outstation, a telephonic conversation or a Skype would be brilliant. And post that, once a month is what is all required, and a telephonic visit can be arranged. And once a month, if you're here, would be a great idea. And at this point in time, I would also want to talk about my support group, which is a very strong point that we have. And it is almost mandatory for all the patients, especially patients who stay in Delhi. at least to come for the support group, because it's a group of like-minded people. It's you operative patients who come there, share your problems, share the solution, and encourage each other to grow and form a community. So a support group is happening every month, and we encourage everyone to join a support group. And you're also linked with me on the Facebook, the Twitter, the LinkedIn, you're on the Skype, on WhatsApp, each day, all day. So this team is a dedicated bariatric team, and I'm very proud to tell you that our team is the only exclusive team in doing bariatric surgery in Delhi and NCR. And we are exclusively focused on bariatric surgery and metabolic surgery with brilliant results. So all the best, have a nice and a brilliant journey, and we'll follow you through.